Hi everyone, thank you for joining me today. This is the first in our series of About videos. Today's video is going to be about education healthcare plans. Now I'm going to try and keep this brief and keep it simple. It is a complex process, but it's one that we can help you through, so it isn't anything to worry about. I'm going to give you some information as we go along. I'm going to give you a website name and just different information about who's responsible for what. So if you want to grab a pen and paper and make sure you have that ready. Also, as I'm going through the video, as you're watching it, if there are any questions that come up, just leave a comment below this video. I'll pick them up and I'll be able to answer them afterwards. Okay? So, Education Healthcare Plan. They're referred to as EHCP for short. And they're almost in two parts. So the first part is an education healthcare assessment, needs assessment, that then leads to an education healthcare plan. So one of the things that's probably the most important to mention right at the beginning is that as an association, our belief is that every child with PWS should have an education healthcare need assessment. There are different reasons for having one in place. An education healthcare plan itself runs from the age of birth to 25 years. For very obvious reasons, it can be very difficult to get an education healthcare plan in place for a baby because they don't usually receive education. But there are other areas that are covered by the plan. So just to give you a brief bit of background, this education healthcare plan was brought in by the government to replace what was known as a statement of needs. There is a process that you need to go through. It can take time. There are strict guidelines in place as to when certain things should be done, at what point of the process. Sometimes these are not adhered to, but it is law that they're followed as closely as possible. So the first website address that I'm going to give you is EHCP. Now, it's a really, really useful website that we use all of the time when it comes to education healthcare plans. It's also got lots of different information on there, but it's going to be really, really useful for finding out things like your guidelines of when certain things should be done. I don't want to kind of spend time getting into it now, but I'm happy to answer any questions that you have about that. And if you have any difficulty finding that information, I'm more than happy to find it for you. So the website address that you want for that is www.ipsea, which is ipsea.org.uk. Now the other place where you're going to find lots of information is obviously our own website, which is www.pwsa.co.uk. If you go onto the section either under information for families or information for professionals as it stands at the moment, and if you go under the education and skills tab, there will be information there regarding education and healthcare plans. So we're going to go right back to the beginning. The reason that children need education healthcare plans is if they need additional support in school. Whether it be for their learning, to help them with their environment, to help them with processing instructions, or particularly for children with Prader-Willi syndrome around break time and lunchtime to make sure that they're supervised. Now, because it is an education health care plan, and the health is very clearly in there, the things that you would look to be covered, or the reasons that you could get an education healthcare plan would include the fact that your child may have an unsteady gait and be prone to trips and falls and need supervision at break times and lunch times. Obviously around the food issue. One of my strongest points that I make is just because a child with PWS at this moment in time is not stealing food or being opportunistic doesn't mean that they won't. And what's important is that we do our best to make sure that the strategies are in place before that happens to help reduce their anxiety and their confusion. So not all children with PWS will need an EHCP when they first start school, but I think that it is very, very important that a needs assessment is carried out to determine that, and that it isn't a decision of a teacher, a teaching assistant, a SENCO or a head teacher It needs to be a decision that is made once a needs assessment has been carried out. So throughout the entire process, parents need to be fully involved, as does the child with PWS, and to whatever extent they can be. So basically what happens is, at the very beginning, if you feel that your child needs a little more support in school, which invariably those with PWS do, some don't, but most do, the first thing that you can do is to speak to your school, speak to the school that they're at, and find out what support they're already offering and how that's working. It's quite obvious when a child with PWS is not coping, because there's usually, there might be some behaviours that start that are not there before. It might be that they're quite emotional. It might be that their demand for food increases. It might be that they seem generally more anxious, or that they start skin picking a little more. So there are usually ways of telling if something isn't quite going right. So your first port of call is going to be to discuss it with the school, and to discuss it with the teacher, with the SENCO, with the head teacher. At that point, you can apply yourself for a needs assessment to be carried out, or the school can do it for you. Again, on the EHCP website, there are templates of letters that you can use, so that you can write them to your local authority. That's where it's going to go. That's where the whole process starts. Requesting a needs assessment, and it's basically just you saying, I would like some information to be gathered about my child because I think they're struggling at school, but for me they need to have extra support in place. What will then happen is that the local authority will either agree or not agree to carry out a needs assessment. Regardless of what that decision is, they have to let you know, and they have to let you know within 6 weeks of receiving that letter, whether it's from the school or whether it's from yourself, whether it's from the nursery. If they're going to refuse to carry out a needs assessment, they have to give you very clear reasons, and those reasons have to be cited in law as to why they feel it's not necessary to carry out a needs assessment. Now, they can use school reports, they can use doctors' reports, and whatever information they may have that's been gathered during the process. But what they can't do as a local authority is just receive a letter that's asked for a needs assessment and say, no, we're not going to do it. There has to be reasons, and there has to have been an investigation as to why they've reached that decision to not assess. So that's the first part. If the needs assessment is agreed to, then what will happen is there starts this big process of gathering as much information as possible. And this is the part as well where it's really important for parents to be as involved as they can be. There is usually within the plan itself, there will be what's called a section A. And part of the needs assessment will be that they will gather your views and your child's views of how you think your child's doing, what you would like for them, what you would like them to achieve, where you feel there may be particular areas of concern. They'll also gather, the local authority will also gather information from the school, and the school should make that information readily available. Now, it doesn't necessarily have to be a report that's written specifically for a needs assessment, but they can use reports that have been there before, but they need to have something that clearly shows, firstly, where they are academically and how they are socially and emotionally. It's then down to the local authority, and this is where a lot of parents can get confused. It's down to the local authority to gather all of the information needed in order to carry out a needs assessment. It's absolutely fine for you as parents to do it, to make sure that you're covered. The information that they will gather will be from your consultant, from your child's consultant, paediatrician, physiotherapist, speech and language therapist. It's quite important to have an educational psychologist see the child as part of a needs assessment, but this isn't always done. It's not always necessary, and every authority works differently. So although the basis of the needs assessment is the same, in different authorities, under different local authorities, you may find that they carry it out slightly differently. But regardless of how it's carried out, there are still strict guidelines and strict laws in place that they have to follow. So Once all of the information has been gathered, which can take a little while, again, you can request it yourself. For the purposes of a needs assessment, the information that's provided has to be within 12 months. It can't be dated any further back than that. You can ring your consultant secretary and ask them to write information and write a report for the purpose of the needs assessment, and if you don't have anything that's within that date. At that point, if the needs assessment is agreed and the information has been gathered, the local authority then look at all of that information. They should visit your child in school. They should take on board all of the comments that the school have made and should take on board all of the comments that you have made. And depending on the results of that needs assessment, because there are times when a needs assessment is carried out and the local authority will come back and say, okay, we've assessed your child, we don't believe they need any extra support. Again, they should very, very clearly outline how they've come to that decision. They have to give very clear reasons as to why they feel that. As is with anywhere, there are schools all over this country that will perform far better than others. And it may be that the school that your child is in has a fairly small ratio of, their class sizes may be smaller, they may have more than one teaching assistant in the class, they may already have a pot of funding where they are able to provide your child with support, and so the need for an EHCP isn't there yet. But what's really important to remember is that at some point during their lifetime, they will need an education healthcare plan. The fact that if you are at a point where you have been refused and they've carried out a needs assessment and you've been refused, let me know below, because we can look into it for you. It may well be that their needs are being covered at the moment, and that what they're actually saying is, okay, we've done our needs assessment, we don't believe you need a plan at the moment, but we're going to review this. Usually at that point is the point that we get involved, and I would have conversations with the school and see how they're doing, obviously with your permission, see how your child's doing, see what your thoughts are, and we keep a very close eye on it, and we tend to review and kind of keep in touch with the school and kind of touch base every couple of months, because the changes are subtle, but we will see them, at which point we're able to say, okay, it's probably time to do another needs assessment. So I don't want any of you to panic if at this moment in time you've been refused, but do let me know so that I can look into it and see what the situation is. If the needs assessment is agreed, it all goes ahead and they come back and they say, yep, okay, so we can see that your child needs additional support. That is the point that the education healthcare plan is put together. You'll be asked again at that point to give your views and the views of your child, and that's known as Section A in the education healthcare plan. The education healthcare plan itself needs to come to you in a draft form before anything else. It cannot be made into a draft form. No EHCP can be put together without the views of the parent and the child. It's illegal to do so, and it will not be a legal document. It won't have been followed properly if it doesn't have those that information in it of what your views are and what your child's views are. Now, it is perfectly acceptable, obviously, that for you to give your child's views. You don't have to interview your child, or because you know them, so you know what their hopes and dreams are. But it's really, really important that you take on board that as parents, you are fully involved in this process. And if that doesn't happen, you don't agree to the EHCP. So once all the information's been gathered, the education healthcare plan itself will have different sections. Now, these again can look different in different boroughs, but it usually runs from a Section A to a Section H, and it will cover the child's needs, what your child's strengths are, what your child's weaknesses are, where they may need some extra help. There is a very important part of the EHCP that will list the learning outcome, so what they're hoping to achieve and how it's going to be achieved. Now, the point about this, I believe it's Section F, the point is, this is the section that is always quite wishy-washy. It needs to be specific. So if in the left-hand column, it's stated that your child needs extra support around processing instructions. In the column next to it, it needs to very clearly state how that is going to be carried out and who is going to be responsible. So if it says something like, teacher will help with this 1 hour a day, it's nowhere near specific enough. It needs to state if it's going to be a teacher, teaching assistant, or a support worker. It needs to state whether it's going to be adult-led. It needs to state whether it's going to be in a small group or on a one-to-one basis. And it needs to state exactly how they're going to help with processing instructions. Are they going to use a visual timetable? Are they going to use like a watch or a timer to help them break it down? Are they going to repeat instructions in different ways? Are they going to ask the child to repeat it back to them to make sure that they've understood? Are they going to give a very definite time period for them to process instructions? It needs to be very, very specific, because when it comes to an EHCP, that is the only section that is legally enforceable. That will also be the section where you are looking to see how many one-to-one hours have been specified. Again, it's rarely put in there, but it should be. It should be broken down so that you have an idea of a total amount of hours. Again, if it's allocated as one-to-one time, it's far too broad. You don't know how many hours that is, but if it's just saying one-to-one time, that could be that your child is receiving 10 minutes a week of just one-to-one time with a particular person. So it needs to be very, very specific. You receive a draft of the education healthcare plan, which is then for you to read and to go over and to have a look and make sure that you're happy with. Again, that's something that we can help you with. We also have education lawyers, Langley Wellington, working with us, who are absolutely fabulous, and out of the kindness of their hearts have offered all parents with children with PWS a free initial telephone advice service of 30 minutes, where you can call them and you can ask anything about the process of an education healthcare plan, anything to do with a special school versus a mainstream school, whatever it may be to do with education, and they will be able to advise you on it, and they will advise you free of charge in the initial 30 minutes. So that's a really good service to use as well. I will happily post the number for that, but afterwards, because I wasn't quite organised enough to get it. You see, we live and learn. So I'm happy if any of you would like that number. Again, if you comment below, I will make sure that I post that number so that you have access to it. So once you have agreed the draft EHCP, you then go to the point where you send it off and you say, yes, I'm happy with this. It's then a final EHCP that is put in place that will detail what the help is that your child needs, where the help is going to be given, and for it to be quite specific of how it's going to be given and how they're going to help support your child. It's very, very important that Prader-Willi syndrome is mentioned in practically every section of an education healthcare plan. It doesn't just come under the health section, because it has an impact on every area of learning. That's then in place. And once that is in place, you are then given an annual review. So once a year, it's looked at, because things change, our children change, and things can come up along the way. And it's reviewed annually to make sure that everything's still meeting your child's needs. One of the other things that you can do is, if you feel that there's quite a big change before that annual review, you can ask for that to be carried out early. And for an early review to take place where changes and amendments can be made. So as much as the local authority have strict deadlines that they have to adhere to, parents do as well, that you have to get the information into them within a certain amount of time, otherwise it won't go ahead. So I'm just going to briefly go over what I've spoken about, just to make sure that we're clear. So basically it's in two parts. You have a need assessment first, that's then put into an education healthcare plan. The needs assessment and the care plan cannot take place without your input and the input of your child. The local authority are responsible for gathering the information, medical information and information from the school, but you absolutely can make sure that you do that yourself and send it into them to make sure that all the information is there. There are very strict guidelines in place and very strict deadlines in place that need to be adhered to on both sides, from the parents and from the local authority. Your website that's going to be useful for you is www.ipsea.org.uk, and that's IPSEA. And our own website is www.pwsa.co.uk. If you go under the Information for Families or Information for Professionals and click on the Education and Skills tab, and there'll be information under there. I do want to say very quickly that in Scotland it does work differently, and in Scotland you would have a CSP rather than an EHCP, but the principle is exactly the same. It's there to help support your child. The process is different. I'm very happy to do a video on that process as well if any of you think that it would be useful. If not, you can again just leave a comment if you are in Scotland and I will help you through that process. So I hope that you have found this useful. I hope that I haven't rambled too much for you. Please leave your questions and comments below, and I look forward to seeing you again soon when we do our next About video. Take care.